my sister's friend was sitting behind me, and she like taps me on the shoulder, and she just like, "What's wrong with your shoulder?" And I'm like, "Oh, it just sticks out." I thought that's just the way it was.
And I just thought it was normal back pain from the backpack because of the books in there.
It felt like there was like a knife like shoved up under my shoulder blade constantly. And I was just like super overwhelmed for a while.
Scoliosis is the lateral curvature of the spine. The spine should be just perfectly straight up and down, but scoliosis is where you see the curvature going off to the side.
Dr. Gerd said the best option would be surgery because bracing wouldn't take it back as much.
For the very small curves, it really won't affect life. But the question comes down to what happens when you're 40, 50, 60, and the curve is now bigger. As the ribs compress on one side, the lungs just aren't working as well as when you were in your teens. And that's why having treatment for curves above 50 degrees at a younger age is the right thing for this.
I asked like how long would I be out because I love roller coasters, and if that was going to affect my roller coaster riding, it was going to be an issue.
We asked him, would I set off metal detectors? Because that's something that would scare me, like going to an airport and then setting off the metal detector.
I was like terrified, and I would stay up like all night like crying, thinking about it, and I would be looking at blogs of other people that had it. I felt alone in it.
The only thing I was nervous about was waking up in the middle of surgery. Like I knew it wasn't gonna happen, but that was the only thing I was nervous about.
I'm not even gonna lie, you will be scared and you will be nervous and there will be pain, but you're gonna get through it because Cleveland Clinic, they're good. They're gonna get you back to where you were before.
And it's Dr. Gerd's specialty, and so I completely trusted him because I knew he was gonna take care of me.
We want to do as little as we possibly can surgically to get the best overall outcome. We place anchors into the spine, which are called pedicle screws. We put a rod in to connect the pedicle screws on both sides and then use these rods to realign the spine, basically to straighten the curve, as straight as we can possibly get it, but safely.
I was in the hospital for 3 nights, I believe. They actually let me go early because I was doing so well with physical therapy.
My back felt sore and tight, but that went away once I started walking. I got there Monday morning and left Thursday afternoon. I was scared of surgery, but there was nothing to be afraid of.
For 6 months, I couldn't bend, lift, or twist, which was very hard, just because it's stuff that you do every single day.
It's gonna take time and you're gonna feel frustrated and a little mad that you can't do what you used to during this recuperating time. But you're gonna be okay. People are gonna help you, your family's gonna help you.
What I do is see them at the 6 weeks, make sure everything is beautiful, and then I see them at 6 months. We get that x-ray, make sure everything is healed, and get them back to the sports and activities that they wanna do.
After the 6 months, he was like, yep, you can go do anything. So I literally did cartwheels to the car. I have absolutely no restrictions right now.
My shoulder sticks out a lot less, and I'm not hunched over as much. And so I grew like 1.5 inches, so I'm happy about that.
My hips are even now. My shoulders are even. Some of my clothes actually fit me a lot better because I'm not all crooked. And now I look in the mirror and I feel awesome.
Yeah, it affected my roller coaster riding for that summer. Yeah, I was sad about that. But now I ride roller coasters like all the time.
It's not a miracle because they do it all the time, but it is for me because it's literally like changed how I feel about like my life. I'm not in any pain anymore, which is incredible, and I'm thankful every day for that.